All right. I am Dr. Alec. I'm the owner of Buffalo Performance Physio. I'm here with Nate. Nate will introduce himself.
So my name is Dr. Nate Reynolds. I'm also a physiotherapist. I own NRG Health, which is located in Rochester, New York, inside Nova Fitness. Um, and so we're going to answer some questions that we've been getting in the gym.
Yeah. So we pulled a bunch of questions from Instagram the last couple of weeks and kind of got some different topics on that. The first major topic that we got a lot of different questions about was regarding squat technique. So we're just going to kind of go through and overview our thoughts on squat technique, talk about a lot of the things that we got frequently, some different modifications and things like that. So the one of the big questions that we get is, should everyone squat the same? And so we have some different thoughts about that. The short answer is no, not everyone should squat the same. I think Nate would agree with that probably.
Yeah, I mean, I think the biggest thing that we both agree on is that squatting is really dependent on your morphology, meaning like the structure of your body. That really
Mhm.
and one of the big things is kind of like your hips. So like if your hips are more inverted or retroverted, that kind of determines whether you should be doing toe in, toe out. Um, and so you should get assessed for that. Um,
Yeah, I think it's definitely worthwhile. Like, if you don't know how to go about checking that stuff on yourself, to find somebody that can help you with it. I know myself, it's a common thing like I see with athletes in the gym, and I've definitely worked with a lot of people on it. And a lot of it is just trial and error. So, a lot of times I'll start with assessing them. You probably do the same thing, Nate, where you're kind of moving their hips around, maybe doing a little scour, kind of feeling out the joint, playing with different angles, and just kind of looking for where we feel the least resistance to try to get the most range of motion out of that hip. And then from there, putting them, in a gravity resisted position and seeing how it plays out from there, whether they can control that. But I usually have most people, if I'm assessing that stuff, I'm trying a lot of different things. I'm trying narrow stances, wide stances, toe in, toe out. And just looking to see if, kind of see where their body wants to go with it, and then see if there's anything that I can tweak for them to make it more
yeah,
comfortable.
yeah, I think it's a good point. Like the one thing I didn't think about was, you talk about leg length. Like taller people tend to
Hmm.
benefit from having a wider stance
Yeah.
just because it kind of shortens the distance that they have to go.
Mhm.
You normally see that the shorter person is typically a better squatter
Yeah.
because they don't have to go as far down to get to full depth. But no, that's a great point of talking about how just hip morphology,
Hmm.
leg length. I think you're going to talk about ankle in a second,
Yeah.
um, and just kind of how that all plays a role into
Hmm.
technique.
Yeah, and also, in addition to like just whether you're overall tall or short, like also your overall like relationship between your leg length and your trunk length is also gonna have an impact on that. So like some people, their hips are make up more of their body, and some people have a longer trunk, right? And that's gonna kind of affect how you are able to get into your squat. Ankles are also a big one, like you said. A lot of people will think that they're really tight in their hips or really tight in their lower back, but the reason they feel that way is just because they're not getting the range of motion out of their ankles that they would need for optimal position. And then they're basically just feeling that kind of up the chain from there, because that their ankles are blocking them from getting to a good position. So that's definitely a big one, especially with how a lot of people are living today. If you're working like a desk job or other things like that, it's not very often that your ankle would be taken through full range of motion in your everyday activities like that. So it is something we want to check. And I personally think that squatting with proper form is one of the best ways to maintain that ankle range of motion over a long period of time, because it helps keep you strong there too. Um, I know for sure I've had people where, as we start working on their ankle mobility and tweaking their squat a little bit, they start to say, when they come up from the squat, they're like, oh my God, I can't believe how much my calves were working on that squat, because normally you're thinking more about glutes and quads and all that stuff. But if your soleus and your gastroc are not used to controlling that tibial translation, it can be a little bit of a wake-up call, like, whoa, they're actually very active during this movement, if we're doing it that way. So I always thought that's interesting.
Yeah, and I think also what to talk about too is, ankle mobility is one of those things that takes time to develop and improve. So sometimes it is best to, lift in lifters or just
Mhm.
bias it so that your toes are slightly down. And I think that'll help you, like you said, like it can impact your knees, can impact your hips. Like our main goal is to get you moving well and get you strong and having good technique. And so sometimes it does, until you get the ankle mobility and it gets better. Sometimes it is better just to cheat a little bit, just so that it doesn't impact other joints and you can actually do the lift better.
Yeah, it definitely helps you starting with that like neuro processing patterning, right? Because if you've been squatting a certain way for a long time and we come in and we try to start tweaking things, like obviously it's going to be a little bit of a mental battle for you thinking about shifting that pattern versus what you used to do. So like that's where I really like the lifters and lifts because we can get the pattern that we want, like basically the same movement. It's just that, like you said, we're giving the ankles time to adjust to the range of motion and new demands that we're putting
Mhm.
on them. Um, I also was thinking about with squats, or one thing that I hear sometimes, or that I do believe is that your squat should be pretty comfortable. So I know I've had a few athletes and other people in the gym that I talk with that like they squat because they were told to squat a certain way, even though it's not necessarily comfortable for them. And even though it might not be comfortable for people to squat, like say if they haven't done it in a while, maybe they're newer, they didn't, maybe they were, a high school athlete and then they got away from moving their body for a while and now they're coming back after some years and trying to get back into it. Like, yeah, you might be uncomfortable even in good positioning for a little while as your body's getting used to that. But if you're somebody that's been squatting pretty regularly in workouts for 3 years, 5 years, longer, like it should probably be comfortable for you if that's where you're going to every time. Especially when you're like unweighted and you're just doing like an air squat, that should not be super uncomfortable for you. That might be a sign that hey, maybe we should look at it and see if you could be in a more optimal position for your body to hit depth.
Yeah, I mean, I think that all makes perfect sense. I think there should be like that short amount of time where like when you're learning a new movement, yeah, it's going to feel
Mhm.
uncomfortable. But if it's something that's been lasting for months onto years and it just doesn't feel right, you're probably not optimizing your movement pattern.
Mhm. Especially something like a squat, right? Because it's like something that should be so ingrained in us. Like it should be a movement pattern that, majority of the population can achieve with a reasonable level of like success. Like it's not something like a crazy gymnastics move, right? That you have to have years and years of strength and stability built up for. Like it should be something you can kind of get working on it and in a short period of time get to where it's at least comfortable.
Yeah,
Another thing that
yeah,
we look at with squat technique is that sometimes we might change, even though we have a certain way that we like to do it. Injuries can sometimes cause us to maybe shift how we tell people, or at least how I tell people to squat from time to time. Um, I don't know. What's your thought on that? What do you usually do when somebody said, say they tweak something and then they feel like, oh, I should just stop squatting for now. Are you of the mindset that you say, all right, yeah, let's not squat at all, or is it let's modify and figure out a way we can still get this movement pattern?
so I think one of the things that like once you bring up how often a squat happens in their day-to-day life, like getting off the couch, sitting to standing is a squat. Getting on and off the toilet is squatting. Like it's not something that they're going to avoid in their day-to-day life. So like once you bring that to their attention, they're like, oh yeah, you're right. Like this is not, it's not like a deadlift. It's not like a snatch or clean and jerk. Like it's something that they do on a daily basis. So I think it's all about just modifying and seeing what they can tolerate. And it really comes down to just explaining your rationale on like why this needs to be able to happen. Or if there's like they have low back injuries or knee issues, there's things that we can do to kind of improve their form or modify it. So like I never tell anyone that like they should stop completely, because I think if stopping's the end, if if I tell them to stop, then I'm not giving them an answer. Like it's
Hmm.
not like I'm not doing my job
Yeah,
because they
exactly.
need to do it.
Yeah, I think it was I'm trying to remember who said it. I think it was maybe Mitch Babcock that said that a good was it a average practitioner tells people what they can't do, and a great practitioner shows people what they can do, right? So like basically, yeah, maybe we need to offload this for a period of time so that we can allow it to heal. But instead of just stopping it there and saying and having the conversation end at by offloading it, it just means don't do this, don't do this, don't do this. The conversation goes more, yeah, we need to offload that. So instead of doing that, we're going to do this instead. And then kind of framing it a little more like positively and kind of, making you see, oh, I can. So an example that I get a lot is like lower back pain and squats, right? It's somewhat common. And a lot of times, what I'm seeing with that usually is a little bit more over reliance on their posterior chain, maybe in their squat. Obviously, you always have your other factors like lifestyle stuff. Were they stressed out? Did they have a bad week with diet and sleep, nutrition? Um, and with all that being even, a lot of times what I see is they had some mechanical flaws that maybe flew under the radar for a while. And, and it basically either they started increasing volume, started increasing intensity, and then these other factors also fell off, and just the total accumulation of that started to bother their back because that was the area that was basically the weakest link. Um, or it's a situation where the mechanics of their squat are further from what I would like to see, so that I do end up changing how they squat. But whether it's a long-term change or a short-term change, a lot of times the goal basically is to try to get them a little bit more upright in their squat. Um, so a lot of times people think in their heads, they're told, sit back into your heels basically when you squat. And for certain people, that can be a great cue, especially if they tend to be a little bit more forward on their toes or if their ankles are tight and so their heels come up. But I will say more often than not, what I see is people that don't have that problem then going back a little too far and basically shifting too much of the stress onto their back. And so if I just do something as simple as cue them to sit down instead of back, they can get a little more upright into their squat, and then it can reduce some pressure on their back. And maybe we squat that way for a little while we let your back heal. And then once it's healed, we say, okay, maybe we can try going back to that way if you want, or if you like this new way better, you can stick on with that. Um, and then in other cases where the back's a lot more sore, it has a lot more symptoms associated with it, we might be transitioning away from a back squat altogether and doing something else like a front squat or a goblet squat or belt squat. So there's just so many options that you can play around with, right? Depending on where your symptoms are. For example, like with knee issues, right? Like you would change up potentially how you might approach that with a knee issue too.
Yeah, like I've seen quite a bit of patients that have had previous meniscus injuries or ACL injuries. And a lot of times what ends up happening is that because it's a structural issue and it's something that like we can't really change, like especially like meniscus issues. Like with the meniscus is basically the brake pad between the femur and the tibia, uh, the two leg bones. And so like when the doctor removes that arthros fraying, you're taking away some of that cushioning, right? So we're not going to be able, like, as our job, like we can't put more cushioning into the knee. It
Mhm.
just doesn't, it's just not possible, right? So there's some structural things that we can't change. So we got to figure out what we can. Uh, and a lot of times what that means is just starting with like some partial range of motion, meaning that we're gonna go to like a shorter depth, or we're going to try to work on improving your knee mobility, because we know that the most compression at the knee joint is at 90 degrees. So like, for example, my brother has had a lot of knee surgeries, and I tell him like squat as much as you can, like let's try to improve your technique, but like let's not flare up your knee. So like if we know that squatting is flaring up your knee every time, then maybe we do partial range and we figure out different ways that we can strengthen your quads, strengthen your hamstrings, make your legs more resilient to reduce the compression in the knee. So that I think that's a good example of how that people that should squat below 90 degrees should be people that have healthy knees. Um, and research has shown it in Olympic lifters that um, that they actually have thicker and more resilient cartilage and ACLs. And so I think it just goes to show, like, if you have a pre-existing condition, then that's where we kind of have to modify. But if you are healthy, the best thing you can do to strengthen your knee and the joints and the ligaments is actually going below 90.
Mm-hmm.
So I think that's how I try to tease things in and out of, like, what's the risk to
Yeah.
reward ratio, and if you have existing issues,
Mm-hmm.
then I keep that in mind. But if you're someone that is healthy, then there's no reason why you shouldn't be going past 90.
Yeah. Yeah. And I think that in itself is kind of like a attaches to the greater theme of when I'm talking with people about squat technique is a lot of times what we're going to do depends on your goals, right? So like there's so many different ways to do it in so many different ways. So like if your goal is more, just hypertrophy, general health, like that kind of gives us a lot more leeway to use a lot of different techniques because we can, if we want to hypertrophy your legs, like we can do split squats, we can do belt squats, front squats, goblet squats. We don't have to do a specific variation if there's something that's painful to you and you don't like it. If you don't have a reason that you really need to do it and you don't want to, that's totally up to you. If you are somebody who's more competitive, maybe in powerlifting or CrossFit or something like that, where, back squatting is going to show up and it's something that you want to be able to do, then that's what we got to work on. And it might, it might take us down a different road to get there. But I still think that for most people, we should be able to get them to a satisfactory squat, like at least, hip crease below knee or very close to it, with a long-term plan with building in the right areas. And for some people, like you said, that just have a pre-existing condition, maybe they had some kind of a surgical intervention or a pretty significant injury somewhere in their leg that is going to block range of motion. Then from there, we just modify and look at their goals and have that conversation of, if you want to hit this goal with this specific movement, you need this much range of motion in your ankle, for example. And so if we'll work on that for a while, and if it seems like it's going to improve, great. If it's not, then maybe we just need to be a little more realistic about what we can do with that. But we're always trying to look at how we can get there and not, just saying, oh, my knee hurts, so I'm not going to squat, right? Like, that's like a pretty good way to make sure that your knee is just going to get worse over time is by not using it. And like you said, if you had a meniscus surgery, for example, and you took some of the shock absorbing properties out of there, well, now you're reliant more on your muscles for shock absorption. So not using it is just going to take away your shock absorbers. So um, we definitely don't want to do that let that go on for too long before they get help with like sorting it out.
Yeah, I think the big thing you nailed on there was, like, it's patient dependent, right? Like, it's
Mhm.
their goals. Like, I had another patient that he's had ACL surgeries, he's had a meniscus, but he's 31 and he doesn't want to stop
Mhm.
CrossFitting. And so what we came up with was, all right, let's see what limitations you have that we can change. Like, we knew his hips were hips mobility was limited. We knew his ankle mobility was limited. And it was just like, all right, like, if we can improve mobility there, or if we can put reverse lift in or use lifters, then we can reduce stress on his knee.
Mhm.
Now he can lift better. That can start
Yeah.
working on his depth, and it all just kind of worked towards his goal.
Yeah.
And so I think that's the biggest thing about squatting, is just figuring out what the patient wants to do,
Mhm.
what their daily life requires,
Yeah.
and then just making sure that you're helping them and guiding them to what they want,
Mhm.
and not just assuming that we
Yeah.
know what's best.
Yeah. I
And
may I
so,
may want a full depth back squat for you, but it may not be what you want, and that's okay. We can as long as you're squatting somehow, we're still cool. So
yeah,
uh,
exactly.
yeah. Let's see. I think we hit most of our things on that one. So you want me to cut the video there and
Yeah, I think that's good.
Cool. Okay. So, another thing that we get asked a lot about, just because it's a really common thing, is deadlifting. So, um, a lot of people, and a lot of people have a lot of different opinions on deadlifting, right? Like depending on where you go on social media or on the internet, like you'll see some people saying, you should deadlift no matter what, and other people saying, that deadlifting is terrible for your back and it's going to ruin your back. So it's kind of a crazy, it's like anything. There's people on far extremes of the end, and then a lot of people that are more in the middle. So, in the short, my short answer is yes, I deadlift. I'm not afraid of it for my back.
Yeah, I think what my what I normally go to is I say a deadlift can either be the best thing or the worst thing for your back. And just to kind of explain a little bit more, like if you do it well, if the technique is there, it's going to make a very resilient, robust back.
Mm-hmm.
But if you're lifting with poor technique and um, there's no really rationale on like why you're doing it, um, then I think it can actually like make your back worse. It's like it's a double-edged sword.
Mm-hmm.
And so I think that's where a lot of times people that have back issues are just not, or
Yeah.
have deadlift issues are just not doing it well. And
Yeah.
you're,
Deadlifts, like, to me, is the hardest ego exercise, right? For whatever reason. Like, I don't know if it's because with squats that, it'll literally like crumple you to the ground with a heavy bar, that maybe some people kind of take it a little bit easier, but because it's got such an easy bailout mechanism to it with a deadlift, I feel like that's where you get a lot of people just, oh, I'm just going to pull as heavy as I can as whenever I feel like it. And if you take that approach, you're probably not going to be able to sustain that very long before things start to get pretty irritated and angry at you, or you have some kind of an actual, injury because of it. But yeah,
yeah,
I agree with you on that.
I think the best place to learn technique is definitely in like a high school weight room. You know, you got all those kids that are just like have no idea what a movement pattern is. They're all just like kind of all over the place, kind of like one of
Yeah.
those. And they're all just like the technique's awful, and you're like,
Yeah.
this is just not gonna go well.
Yeah.
Or you go to like one of those like Globo gyms, and then there's just a guy that's crunching in the corner, deadlifting, 400 pounds, but his back is just arched, and you're like, well, that's a future client.
Yeah. Yeah, it's one of those things where it's like if you're really diligent and very what's like take time, take smart jumps and build it up over time. Like there's a couple of those Russian guys, right, who
Mhm.
like they'll deadlift with like a mostly rounded back, but it's also, I mean, if you really look at it, they're really rounding through their thoracic spine. They're still keeping their lower back a little bit more like in a neutral position, even though we know based on research that no matter what you do, like you're getting flexion out of your back when you initiate your deadlift. Um, I think for us, it's just more about making sure that the amount that you're going through with the load that you're using, your body's built up to tolerate it. And the easiest way or the best way to do that is to go slowly and build up over time, and not just walk into the gym and be like, oh, I deadlifted a plate last week for the first time, so we're going 2 plates today, and then next week will be 3 plates, and I'll just be the strongest guy here in a month and a half. Because our bodies need a little more time to adapt to what you're doing than just a few weeks. So that's something I see a lot, is just probably too much too soon.
Yeah, and I think just so people know is like when you first start working out again, your first 2 weeks of like strength are not real strength gains. It's just learning how to recruit those muscles that have been inactive.
Mhm.
So like those big gains you get early on are just your body's waking up,
Yeah.
and you're getting used to those movement patterns. So like strength gains really are until 4 or 5 weeks after you start.
Mhm.
And so yeah, like you're right. Like having a plan, doing it um, consistently and gradually is the best option, because like gradual exposure is what's going to make your back stronger and
Yeah.
more resilient.
Yeah. The worst thing I think, or the thing I hate seeing the most is people who are like, I hurt my back deadlifting, so I just don't deadlift anymore. I don't bend forward. I try to be careful about how I pick things up, all that kind of stuff. In most cases, right, we're trying to work on restoring full function. So like, I don't consider if you come to see me because of an issue with your lower back from deadlifting, I'm not considering you fully rehabbed until you can deadlift back to where you were before, if not more, assuming like we talked about before that that's your goal, that you want to keep doing that. And usually I'm encouraging people, right? Like I don't want people to lose that goal just because they're afraid that it's going to hurt them. Like you said, as long as you do it slowly over time and we build you back up, there's no reason not to continue doing it.
Yeah. So what like movement patterns or faults do you see most often in the gym?
Like in terms of like what you see going wrong with deadlifts or when they might become a little bit more risky, are you saying?
Yeah, exactly.
Um, so a lot of times I think the biggest thing that I see is just a poor leg drive out of their start. So either like they're not getting enough tension, not taking the slack out of the bar before they go to lift it. And then once they start to come off the ground, basically not having a uniform motion with their shoulders and their hips. So a lot of times what I want to see is regardless of where your trunk angle is, because that's going to change a little bit based on your leg length and your levers, and your arm length. But wherever your hips and your shoulders set, I want to see that kind of stay steady as you come up off the ground until you get to about like knee height or so. And then you're gonna bring your hips forward and like lock that deadlift out. But too often I see, either shoulders shooting up first or hips shooting up first. And then that just tells me that they're not getting a solid movement pattern in terms of driving from their legs and keeping their back pretty stable because it's moving basically, while they should be holding steady.
Yeah, I think just some like cues on like how to fix that. So I think a lot of times when someone like initiates the movement with their shoulders first,
Hmm.
they're just not initiating, they're not pushing away from the ground for the deadlift.
Yeah.
They're starting to initiate that movement with their back. So they're just arching up
Hmm.
and like and so then it really should be, like you said, legs initiating the movement. And then with what we call the stripper fault, where the hips
Hmm.
rise up first,
Yeah.
um, it's just they're not pushing through their quads. They're just they're pushing back and not up. And so I think that's kind of how we can cue that to kind of improve that. Um, but yeah, like you said, we want to see the hips and the shoulders rise together.
Hmm.
And there's what modifications do you normally give someone to kind of work them back into deadlifting if they've had an injury?
Yeah, so it really depends on like what their back is more intolerant of. So you've probably seen it with working with people, but sometimes they're going to be a little bit more intolerant of the pure load that they're lifting, and their range of motion isn't as much of an issue. Sometimes they're going to be more intolerant of that deeper setup. So like having more flexion on their back as opposed to the load. So based on that, that'll kind of guide me on whether, okay, if they get the range of motion okay, but it's more heavy loads, then I'm still trying to get them through as much range of motion as possible and just modifying the weight on it. If, which is probably more common, is that they have some sensitivity into flexion, some intolerance for that, then we're going to start to modify around that. So maybe we're doing rack pulls or like elevated deadlifts off a little bit higher off the floor. And you can also change their trunk angle similar to the squat to go a little more upright with something like a sumo deadlift or hex bar, depending on what you have available to you. Anything you like to do other than that stuff?
No, I mean I think that's basically what I do. Like you said, like someone's flexion intolerant, and that you want their trunk to be more upright, and so then it's really just either modifying the range of motion or you know using a hex bar, using changing the deadlift so that they're instead of their arms being outside their knees,
Hmm.
the arms are inside it, so it just creates that more upright torso. Um, and so it's just trying to figure out what they can tolerate, and then gradually trying to get back to um, the traditional deadlift.
Hmm.
And so I think you nailed it. I think you did a good job of explaining like why we do certain things. Because a lot of times, the patient they just see a deadlift and they don't understand the nuances that are involved in it. And so there really is some deep thinking that we do to try to figure out how to keep them deadlifting, because it is such a
Mhm.
vital part of their day. I mean, like if you're a construction worker, if you're lifting a bag of concrete, it's 80 pounds. You're doing
Mhm.
that 30, 40 times a day, like you're going to need a deadlift. Or if you're picking your kid up, you're going to have to deadlift.
Yep.
Um, so it's
Yeah.
it's a very